A specialized clinic in Carmel is unlike any other in the state, helping patients with heart disease and diabetes. WRTV's Alyssa Donovan explains how one Indiana man was given a second chance at life.
When I first was in the hospital, I was almost 340 pounds.
Ted Meadows spent his life working in a factory in Kokomo. The 57-year-old struggled with heart problems for years, ending up in the hospital in 2017.
Finally went into the emergency room one evening, and of course they hooked me all up, and they ended up flying me down to Indy. I'm sorry.
An emotional memory for Meadows, as that's when he and his family learned that he had an enlarged weak heart. The father of 4 was given an LVAD, a battery-operated device that connects to a failing heart to keep it functioning. But he was also told eventually he'd need a transplant.
In order to be on a transplant list, you have to meet certain criteria. When we met Ted, he didn't meet the criteria for that, so he was taken off the list.
Specifically, as a diabetic, Meadows' hemoglobin A1C, which is a measure of your blood sugar control, was too high, and he was too overweight. That's when he was sent to Ascension St. Vincent's Cardiometabolic and Lipid Center for help.
I help identify the educational needs and the barriers that patients have regarding getting their medications, like with Ted.
Insulin, I mean, a 3-month supply, even with my insurance, was over $400.
The clinic helped set a diet and exercise plan and assisted with paying for his insulin to get his health back on track.
We have special programs that we can help them get money to pay for these medications.
In a matter of months, Meadows lost 75 pounds and lowered his A1C score.
So he's now back on the transplant list.
He says if it wasn't for the help of the doctors and nurses at the clinic, he's not sure where he would be.
I wouldn't have been able to get back on the list.
I'm Alyssa Donovan, WRTV.
Amazing story there. The clinic has only been around for a little over a year, but in that time, it has seen a steep increase in the need for what it is providing, averaging 5 or 6 new patients a day.